Hey, it's Dr. Kim with Signature Chiropractic, and today's video is going to talk about maintenance care. What is it, and do I need it? And so, a quick story is that lately, usually, like I might have mentioned in some of the past videos, if I see several patients that are coming in for the same thing, or the same condition, or they have the same questions, I like to think that most patients are probably thinking or going through the same thing. So, maintenance care, what is it? Maintenance care is when we have patients who are coming for a condition or pain or a situation where we have treated them, taking care of them, we got them to where they are able to function, move, and operate exactly they want to do. They've gotten back to their exercises, all the goals that they had for their treatment, they're able to do. After that, what happens? A lot of patients, they will tend to stop, which is a shame, and they don't do what we call maintenance care. Maintenance care is similar to like someone who has braces and they get their braces taken off, and the orthodontist will issue a retainer, and they want to make sure that all the hard work and the weeks and weeks of care that was delivered to their bodies to maximize how their body is functioning is continue to do that, and it doesn't regress and doesn't go backwards. Just like if you don't use a retainer, the teeth will shift and go back. And so that's what maintenance care is for. And we typically recommend, depending on the patient, anywhere from once a week to every other week. Some patients is just more like once every 3 weeks. Every patient is going to be different, but for the most part, most at a bare minimum, every other week, patients are being seen and adjusted. And so we have had just this week several patients who I have not seen in 1 in 4 months, another one in 6 months, another one in like 5 months, all coming back for the same thing that they initially came in for. And it's frustrating not only for them, we love our patients, but we don't want to see them 3 times a week for the rest of their life. And the patients don't want to do that either. And so it would have been much easier to take care of that patient who is healthy and doing well and keeping them well versus waiting for their body to implode and break down and shut down and then making a decision and trying to get them back up to par of where they can function and move. So I mean, I want you to just imagine, like, what does it look like for someone's mouth or someone's teeth if they didn't brush their teeth, floss, or mouthwash for 4 months, 5 months, and 6 months? How long do you think it would take before their teeth starts getting sensitive, gets achy, starts rotting and decaying and breaking down? And that's the same thing with the spine. And so I definitely highly encourage, is maintenance important? Absolutely. Would I recommend it for everybody? Absolutely. Even I get adjusted once a week, not because I'm in any pain, but because I want to keep my spine healthy, moving, so that I can keep all of you guys moving and healthy. So keep up with your maintenance care. Don't wait for symptoms to implode. And most importantly, so a lot of these patients that I've seen, they tell me that their pain has been going on for several weeks or even a couple months, and they knew about it. And it's like, as silly as it sounds, and I don't mean to harp on the patients, but I mean, imagine your smoke detector alarm is going off because it's detecting smoke from a fire, and you just ignore it. I mean, eventually your home's going to burn down because you're ignoring the fire that's going on, and that's not something that we want to do with our bodies as well. So want to encourage you guys, what are some tips that you can do is definitely just keep up with your maintenance care. Do all the exercises that we've given you. Do the stretches and some of the other exercises that we give you, watching your postures or ergonomics. And yeah, just get your maintenance care and you'll do well. You're going to go and continue to function, operate, and heal. And look forward to seeing you on the next one and giving you some more tips here. All right. Thanks again.